Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Women. Now coming into the body changes part. As you can see here, this is the female reproductive system. Here we will be discussing why you have primary dysmenorrhea and why you are experiencing secondary dysmenorrhea. See, as we've already discussed in the structure and functional part, that the endometrial thickness was increased so that they're anticipating a baby. The fertilization is not occurring, the endometrial layer should come down, right? This layer inside the uterus, what is it called? It is called as the endometrial layer. And this layer will release prostaglandins, okay? So PEG alpha and then PEG1 or PEG as such prostaglandins, you have to remember basically, these will be released, okay? So what do these prostaglandins do? If you have to get rid of this endometrial thickness and it has to come down, the uterus should have contractions. Same manner like if you are eating food and the food should travel from the stomach to your rectum. Okay, it should have peristalsis, that is muscular movements, so that the food is moved from from your esophagus till the rectum. There should be certain movement from the esophagus, it will go to the stomach will churn and it will send to the duodenum. From duodenum it will have peristaltic movements to send to the rectum. In the same manner, for this endometrial layer to come down, you need uterine contractions. These prostaglandins are usually released. What will they do? Their work is to cause this uterine contractions, and also they will cause vasoconstriction, that is the blood supply. Usually what is vasodilation is that if this is the cross section of the blood vessel, what do this prostaglandin do is they constrict the blood vessel, they make it smaller. Okay, making it big is called vasodilation, making it small is called vasoconstriction. Sometimes this prostaglandins will cause so severe form of uterine contraction that it will usually press the blood vessels which are supplying it. The blood vessels usually get up pressed, okay, and this pressure or this pressing sensation will cause severe pain. That is why you will be experiencing pain in the primary dysmenorrhea. So what is happening is that the prostaglandins are released and usually contractions happen in certain section of people and do not experience any sort of pain. But in some section of people, especially people who are experiencing dysmenorrhea, there is increase in prostaglandins, and this increase in prostaglandins will cause severe form of uterine contraction, which will cause vasoconstriction, along with they will press the blood vessels because of the severe uterine contraction. And by pressing those blood vessels, there will be severe pain, and the uterine contraction itself is also very painful. So this is the main reason for primary dysmenorrhea. And then what happens in the secondary dysmenorrhea? What happens in the secondary dysmenorrhea is that any endometriosis, that is endometrial layer being deposited anywhere, or adenomyosis, this layer going inside, or fibroids, that is tumors happening, all of this will cause certain factors, or pathologically they will run certain symptoms in the uterus, which will cause the uterus to have a lot of pain. Okay, the pain index will increase. So it is different for each and every disease. The pain pattern or the cause of the pain for endometriosis is different. The cause of the pain for fibroids is different. The cause of the pain for adenomyosis is different. Cause of the pain for ovarian cyst is different. Cause of pain for PCOD is different. So all of this together will have painful or very, very painful menstruation, or dull aching pain throughout the menstruation and after the menstruation also. Or they can cause symptoms like abnormal uterine bleeding or irregularities in bleeding. If you have any of these symptoms, do not neglect them. So these are the body changes that occur. If you're someone who is experiencing pain during every menstruation and you want to decrease it, that is primary dysmenorrhea. And if you're someone who is experiencing pain along with other abnormalities in your flow, that is secondary dysmenorrhea, and you would like to get in contact with us, we have two kinds of consultation options. One is the online consultation, the second one is the offline consultation. If you're someone who is staying nearby the nearest branch of Fidicus, you can come and contact us in person. If you're someone who is staying far away from us, you can contact us online. We have two options, that is audio consultation as well as video consultation. After the audio and video consultation, if we think you are suffering from secondary dysmenorrhea, we will ask you for investigations, or if you have already done investigations, you can send it to us. And after the doctor consultation and after the whole process is done, your medicines will be delivered to your doorstep. That is, home delivery option is available, where if you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. And if you're staying anywhere else, it can take 4 to 8 business days for our medicine to reach your doorstep. If you want to consult us, you can call us on this number. You can WhatsApp us, you can message us, or you can call us. If you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. So if you're someone who is experiencing painful menstruation and you do not know what kind of painful menstruation it is, that is primary or secondary, or if you're someone who is experiencing pain in every menstruation and you would like to get rid of the pain to have a better work-life balance, or if you're someone who is experiencing pain along with the abnormalities, that is female reproductive problems, you can contact us. And also, why should you choose Fidicus Homeopathy? Because Fidicus Homeopathy stands for highest chance of health. Here we have 3 principles. One is the highest success rate. See, we are already experiencing a rush of patients who are approaching us for different female reproductive problems, and the success rate is really high. It is good. And also, there is transparency in treatment. That is, that there is no gray area between the patient and the doctor. Any sort of prognosis that you should be knowing, we will be letting you know. And also the personal care here at Fidicus. If you have any sort of myths, or if you have any sort of queries regarding your own problem, we will be educating you. And not only that, we will educate you in all aspects of your problem. So if you want to choose cure, if you want to choose a better life, choose Fidicus Homeopathy. Thank you.